Hi, it's Dr. Shirlea North from Nurse Physical Therapy, and welcome to all those who are new to this podcast. And thank you for those that are returning listeners. I really do appreciate all your support. So, this episode, we're recording in the month of June, or it's being released in the month of June. And so, June is a famous month for not only our celebrating our Pride Month, which take a peek at that podcast, but also for Father's Day, right? So we tend to want to focus a little bit more on our males. Okay, so I am in my language for this podcast going to be very male oriented and male parts and things like that because I really want to help attract this conversation to you all. Okay, so men do not understand or do not want to admit that they can also have pelvic health conditions and issues that are not normal. Okay, so as much as we want to say that pelvic health is only for females and only for postpartum, that is not true either. It is very needed for that population. However, we miss the boat for all the other age group within when we're talking about binary men and women. And we also within the LGBTQ plus community with trans surgeries and transitions hormonally and how that affects tissues, all those things. But for this podcast, we're going to focus more on males and anatomy. Guess what, guys? You have a bladder. You have a bowel, and you have sexual function, right? Sexual tissue. And so that all needs to be working optimally, right? So when there is the normal aging process, like yes, you may not have fluctuating hormones like the female body does with having a menstrual cycle and all the things, but your body also changes as it ages and how your hormone is being released and with the ability to not only create sperm, but to be able to ejaculate sperm in order to be able to have erectile tissue do its thing and be sensitive and all of that. You also need to make sure that's working okay. Your urinary function. Is there any hesitation there? Is there any urgency? Is there any pain? Is there any pushing you feel like you have to do to fully empty your bladder or to start the flow in urine? Or does it start, stop? How are your bowels? Are you constipated? And does it take you forever to have a bowel movement? Or are you just sitting there checking on your phone? Now, I can't fix that. Right? But constipation is the big thing. Excuse me. And then also, like we mentioned, the sexual function as well. Now, your pelvic floor is almost the exact same as the female pelvic floor, especially when we're looking at the innermost layer of it. You have one access point, yes, your rectum, whereas the female body has two. So that's where the anatomy is slightly different with that. And then, of course, the external genitalia. However, the nerve endings on the glans penis is very similar to the nerve endings of the clitoris. However, the clitoris has thousands more nerve endings than your glans penis, so we definitely have more of the pleasure on that fact. But wanting to make sure that we want to, again, help normalize that when I am with a male client that has urinary, bowel, or sexual function, or a little bit of everything, that I'm showing them on the model, right? This is you, right? These are your bones. These are the muscles. These are the soft tissue things. Here are your nerves, your veins, your arteries, all the things, right? And then, then they often see the female one, like, oh, this looks pretty similar. Yes, it is. And so you have every bit of the right to have a optimal functioning pelvic floor muscles in order to be flexible and strong. We joke that guys tend to be a little bit more of a tight ass, and guys tend to glute clench a little bit more. But then there's a lot of, oh, we need to bulk up, but there isn't a lot of like tissue flexibility and laxity. So that goes into working out and making sure that you are doing, not only the strengthening, but also the stretching and flexibility and mobility piece. So I often find that the contributing factors to men and their pelvic health symptoms are pretty similar to females. I have had males that are hyper mobile in their joints and that their pelvic floor is tight or has tension because it's the only thing hanging on because your hips or your low back are super hypermobile. And the reverse, I've seen a lot where men are very tight in their hips. And so it creates such a tension on the pelvic floor that the pelvic floor has a hard time relaxing in order to fully empty bladder or unable to fully empty their bowels or to have an erection and not have pain. So yeah, you guys deserve to have pain-free sex too, no matter what is being penetrated or who's being penetrated. I don't really care. We want to make sure it's pain-free. So yes, men have pelvic floors too. So this is where I have given a lot of providers, especially urologists, a pelvic floor screening tool that say, hey, let's ask the question. Okay, let's ask the questions of how our bladder function, not only for bladder, because urology, you think bladder, you think urethra, okay, cool. But what about your bowel function? What about your sexual function? Not every man needs to be put on Cialis, right? Not every man with a pelvic pain has prostatitis. And we'll get into that in my next podcast. But stop dismissing these symptoms. And so I am feeling that there are sometimes when, like if a woman goes into their either primary care, OBGYN, whatever, their provider, and they may be saying, hey, I have a really painful menstruation, or it's very heavy. A lot of times, unfortunately, there's still this medical gas, oh, that's normal, just take some pain meds and off you go. We really need to be exploring that. But with guys, when they have like pelvic pain, it isn't just their prostate. Just because you have a prostate doesn't mean, that there should be this norm. Oh, urination's going to be a little difficult, or, oh, yeah, doing the start-stop thing is normal because you have a prostate. No. Now, when men need to be honest and to be able to ask the questions or to say, hey, I have a problem here, they need to be well received in the medical community of, okay, let's help you. Let's connect you with a pelvic floor physical therapist. Now, many pelvic floor physical therapists are female, and unfortunately, a lot have their own trauma or baggage or insecurities. And so when they are treating somebody of the opposite sex, that can be met with some difficulty from prior personal experience. But overall, it just needs to be respected. Okay, this is a professional setting. We may be having to do some manual treatment to those tissues, just like how we would do any kind of soft tissue mobilization anywhere else. But we need to respect the area, and we need to obviously properly drape, properly educate. This is what we're working on, having intention with our touch in terms of we're just not poking around either. We need to know what we're doing and how we're doing it and be able to explain that. I had a male client just the other day, and we had to do some myofascial release work right along either side of his anus and going into towards the base of the penis, because that's where a lot of the pelvic floor muscles are. We were doing some myofascial work because he came in with pelvic pain, and we were finding the contributing factor. Ooh, that's where some tension is. Let's reduce that tension and help get those tissues to move a little bit. And I told him just straight up, yep, I draped, we're all covered, we're all good. We're just uncovering what we need to work on, and that's it. However, I do need you to understand and to respect that with any kind of touch in this area, especially, there may be some reaction within your erectile tissue, and that is normal and that is okay. If we need to stop, we will stop, take a break, and then come back, and we can continue, or we can adjust the position of things. Like, that's okay. I also try to have my clients engage with assisting with moving certain tissues out of the way. For example, the scrotum is in the way of the external pelvic floor muscles sometimes. So I need them to help me. Hey, can you hold this? Or using either a towel or a drape sheet or something to drape that so it's covered, and that way they can hold it and they can hold their own soft tissue. And I'm also coaching them how much to pull or not pull, right? Because we don't want to overstretch things. So I really engage my clients so that way they can also learn the technique to do that at home to the best of their ability from where they can reach as well. So that goes with a female or male pelvic health. Like, we're having a mirror. I want them to be able to connect with that area. It is a very, yes, private area, but there are neural connections. And we want to make sure we can really close that loop so they know that if someone comes in with pelvic pain and hypersensitivity or something like that, or even my male client I was talking about before is actually numb in certain areas. And so we were discovering there is a lot of muscular tension that's pinching off or compressing the superficial nerve that serves that area. And that's where the numbness is coming from. And so we need to move that tissue, but then I also want him to be able to do that soft tissue mobilization at home. And we were figuring out how we can do it in what position as well for him to do that comfortably at home. The best thing we can do as providers is give you the tools and techniques to carry that over beyond our session, and that we progress it, right? And that we say, okay, that's great. Now that has gained some flexibility, let's get some more stretching and some more global mobility going on. Like, this individual's very tight in their hips. I can sit here and do all sorts of soft tissue work right in that area, but if I'm not addressing the hip stiffness, it's going to go right back. Use the same approach regardless if it's male or female. Anatomy does not matter, but we want to help elevate, really to help encourage and give that confidence to men to talk about this stuff, right? It is not a normal part of aging to stop having an erection, right? And what's amazing is that the cardiovascular system is actually telling you something. So if you have difficulty attaining an erection, especially from overnight, and yes, the morning would, but if that is a reduction of amount, either amount of erection or amount of frequency, that could potentially be a sign of what's going on with the cardiovascular system as a whole. Those vessels along the penis are very small. So if those vessels aren't getting enough blood flow and everything, then what else is going on, right? But we don't want to freak people out. We're like, oh my God, I need to go see a cardiologist right away. I'm going to have a heart attack. No, but for those that do develop erectile dysfunction, there is a higher likelihood that there is some other cardiovascular issue going on. And that sometimes is an indicator of it. So erectile dysfunction is sometimes like the symptom to something bigger, right? So we just want to help normalize this conversation of, how are your erections, at what capacity, what percentage, how long is it able to last? Because some of these medications are not normal. To have an erection for 4 hours, that's ridiculous, right? Normalizing being able to utilize something like a penile pump after a prostatectomy, or a penile pump after having a phalloplasty to help with that. So we just want to help normalize these kind of conversations within the male community, that you have a pelvic floor too. You deserve to have optimal bladder health. Not only the bladder is the organ, but being able to pass that urine as well in a pain-free way. So how's your positioning? Do we need to sit, stand? How are we standing? How are our joint mobility for our low back? Is there low back pain and bladder issue? Is there low back pain or hip pain and constipation? That could be a thing. When you are working out or powerlifting, do you have fecal incontinence? What's going on there? How is your sexual function? Things like that. So I'm just listing a whole bunch of examples. If someone has prostatitis, is there really inflammation of the prostate, or is it something else? Is there any nerve issue? pudendal is a fancy word there, or is it coming from another nerve root, from the low back maybe? We want to just help, again, normalize these conversations so that way these symptoms can be openly talked about with providers. And also, guys, do your due diligence. Look something up. I don't know how many of my male clients just Googled me and the fact that I feel comfortable treating those within the male population, I'm few and far between. So I know as providers as a whole, we need to be comfortable and to work on ourselves so that way we can feel comfortable working with those of the opposite sex if there's any prior trauma on the clinician, right? So we're all people too. So we want to, I also always say with all my male clients, I will always ask permission for consent to move forward with any kind of external or internal pelvic exam. However, I also will need your reciprocal respect of when there is a certain reaction or a certain request that we need to respect and be professional with that. And then I will also let them know, like I mentioned earlier, that if I'm almost expecting a physical reaction because of the tissue I'm working on, I'm going to normalize that reaction is okay. There's nothing wrong with you there. However, you need to let me know if we need to take a break or if the reaction is going a little more emotional. We take a break. Okay, we take a break and we can either come back to that session or we take a break and we just stick to more external things. We put our clothes on and we move on to something else. And that is perfectly okay and normal. Okay, because that can happen and it's okay. It is okay. There is no judgment here whatsoever and it is okay. So I hope through this podcast, again, we're trying to normalize the conversation. Guys, talk to your physicians about stuff that's going on. Talk to your partners about what's going on too. I often will have a couple, whether it's homosexual or heterosexual or trans, everywhere in between, that if the penetrating partner or the penetrator or penetrated partner, if there's any pain with that, we want to talk through the mechanics of things, understanding that there is a nervous system involved with that and it has its own physical reactions as well within the pelvic floor. So you're not alone. Pelvic health physical therapy is not just for women. It's not just for postpartum. It is for everybody, including guys. For Male Pelvic Health Month with Father's Day right around the corner here, we want to normalize that conversation and please get the help that you so deserve as well, guys. All right, until next time.